For 5 months now, services at the public health facilities have remained paralyzed owing to the nurses' strike, bringing suffering to Kenyans who could not afford Medicare at the private health facilities. After months and days of consultations with the government and Council of Governors, at last the dark tunnel is seeing some light. The strike, the longest ever in Kenyan history, has been called off.
So with the powers conferred to me, with the Union Constitution and the Labour Relations Act, I hereby declare that the strike that began on 5th June 2017 is officially called off, and our members are advised to go back to work with immediate effect, those who can manage now, and for those who cannot manage, they should report back on duty on or before tomorrow, 5 p.m.
In the pact into this Thursday afternoon, the two levels of government agreed to raise the nurses' salaries, including uniform and allowances. In the agreement, nurses will earn an allowances of 15,000 shillings in the 2018-2019 financial year, to be increased at a rate of 5,000 shillings for the next 3 years. Service allowances to be pegged at 23,000 shillings, to be increased to 30,000 shillings in the 2020-2021 financial year.
Year 2018-2019, financial year 2018-2019, 15,000 shillings will be the allowance, and this will be increased annually by 5,000 shillings over a period of 3 years. Which means in 2019-2020 financial year, the allowance to be paid will be 20,000 and 25,000 the financial year after that. Nursing services allowances, we have agreed to pay 23,000 shillings financial year 2018-2019 and increase that increase that by 3,500 during the financial year 2019-2020.
The health workers on their part have agreed to resume work Friday, and counties will be required to release withheld salaries latest by end of November 2017.
We have agreed with the government. I know that the agreement may not be sometimes happy with some of our members, but I can tell them this is what we have been able to get from the government. We are going to have our CBA finalized within 30 days as we have agreed, and I believe from the spirit I've seen from the side of the government, we shall be able to complete that collective bargaining agreement free from any sort of hostile environment.
The government had earlier threatened to sack striking nurses, claiming the impasse was not lawful. However, all disciplinary action against the striking nurses has also been suspended forthwith after the signing of the return to work formula.
Services have been going on in the national institution, especially the referral institutions, which have been overwhelmed by referrals from the counties. I know a skeleton staff have been working at the respective institutions, which has not been adequate to cater for our people. I know the gap which was left since June has occasioned and foretold suffering.
Thank you. Brenda Kiprono reporting for Channel 1 News Hour.